I am joined now by Dr. John Showalter. He is the Chief Product Officer of Linus Health of Boston, Massachusetts.
Yes, very excited to
Red
be
Sox fan?
I am not, but my whole team is.
Whole team, okay. Patriots fan, probably?
No, probably not. I'm from Pennsylvania, so
you're
definitely not a Patriots fan.
You're the other teams, yeah, okay. which have done pretty well.
They have. It's a very interesting discussion to be, mostly remote and have a big Patriots team, and I'm not rooting for the Patriots.
So we're here on the first day of HIMSS. Have you been to HIMSS before?
Yes, I've been to HIMSS for many years. For many years.
Okay, so I see you're the Chief Product Officer. That means Linus Health has some really cool products.
Yes. So I'm the Chief Product Officer. I have a responsibility for the product analytics team because we are an AI company. We make digital cognitive assessments, which is a iPad-enabled AI technology that allows medical assistants to assess people's brains.
You're talking about brains?
Brains.
Wow.
Yeah.
So the waves that are going through your brain and all that kind of stuff?
Yeah, so we're really focused on the functional part.
Okay.
So we've taken the classic paper and pencil tests, put them on an iPad, put AI and analytics behind them to bring an MA up to the top of their license and allow them to do what a psychometrician would do for a neuropsychologist, administer those tests in a reliable way, and provide that information to their primary care doc or their neurologist or their geriatrician in near real time.
Everywhere I go, people are talking about AI. So it sounds like you've really embraced this. And where do you see it going in your field?
So we've definitely embraced it. I'm definitely in the augmentation camp. So how do we use AI to make clinicians more effective, get more work done, bring people up to their optimal performance? So how do you take a scarce resource like a psychometrician, put it in a box, give it to a medical assistant that every primary care physician has, and make that kind of testing ubiquitous? That's really where I see AI going, this ability for us all to be better, not to take over anything, not to really replace us, but how it's going to make us better and allow scarce resources to be more democratized.
I think if AI is put into a very positive usage, it's a good thing.
Yes.
As long as people aren't using it for terrible things, I think AI is certainly beneficial.
Yeah, we clearly see with the hackers, you can use AI for terrible things, but absolutely, with the right purpose and the right technology, making clinicians better at their job is a, really valuable use of technology and analytics, and we can be really good at it.
Well, I think it makes the whole system more efficient as well.
Yes.
So, and if it's more efficient, hopefully, it's more cost effective.
Yeah, and this is one of those areas where the most costly condition to Medicare and Medicaid is dementia, and 40% of dementia is preventable if you catch it early. But you and I couldn't catch early, even as a primary care physician. There's just so much beyond the human eye in order to detect and identify those early signs that you have to use technology. And the ability to capture information on an iPad at 120 times a second gives us, a kind of superhuman understanding of the brain's performance, the brain's function, and allows us to catch things years before they manifest in symptoms, when I can still help your brain by helping you control your blood pressure, getting your diabetes under control, losing weight. So there's all these lifestyle things that can be done to prevent dementia if it's identified early on, but we can't identify it with the naked eye.
Wow. Well, I know that I have no idea what's going on in my brain half the time, so I got to tell you, Dr. Showalter, you have given me some really good information here that I think people really are going to want to know more about what you do and how can they engage with you and find out what you're doing now and in the future.
Sure. So the easiest place to engage with us is either on our website at linushealth.com or on social media, particularly LinkedIn. So we're very active on LinkedIn, and you can find all of our big updates and announcements and technology advances coming out every month on LinkedIn.
Super. Dr. Showalter, thank you so much for being here.
Thank you. I really appreciate it, David.